So we want to talk a little bit about myofascial release. A lot of people have heard that term but don't really know what it is. A lot of what it's dealing with is the fascia. And so what the fascia is a connective tissue that connects, surrounds, penetrates muscles, tissue, bone, organs, nerves, everything is surrounded and infused with fascia. And it is connected from head to toe. It's a continuous system. So it's not isolated of a spot here and a spot there. It's what connects the whole body together. So you can have spots that are in different places connected, so maybe something down in the hip or knee might be connected to something up here in the shoulder. And so when we're working on different things, if we look at the whole body and take that into account, that helps us to get a better picture of what's going on rather than just trying to say, oh, this is a knee problem, we're just going to focus on the knee. And so some of what we do with the fascia is look at what posture and alignment is, because the things that can affect restrictions in the fascia is trauma. And so things like car accidents, whiplash, injuries, surgeries, they'll all cause the fascia to restrict and tighten. But postures will too. And so poor sitting posture, poor standing posture, you see how we straighten up when we said that.
Yeah. Go back to bad posture.
So that can all create some tightness. So you may not be able to see as well on camera, but like right here, there's some tightness right through here in her mid-back. Her shoulder blades are sticking out just a little bit right there. So there's some tightness in there. And so that's some of what we look at is being able to see what things are out of alignment, looking at our hips a little bit. This hip is just a little bit higher here, this pelvis. And so those are things that we look at to try and balance things out. That gives us an idea of where to start, is just looking at where things are, and then we get into it. And a lot of it is feel and feeling what's tight. And so let's have you go on your stomach for a minute, Aubrey, and I'll show things here. So we were talking about things being straight here. So let's move this down just a little bit so that's frees your neck up a little bit. So the skin is connected to the fascia. And so there's some techniques we use like A-stem that we put some lubrication on the skin. With myofascial release, we don't want any lubrication because they use the skin as a handhold to be able to reach the fascia. And so you can see, maybe you can see, is the skin is moving here and it moves a little bit and then it just stops right there. And so that's where some of that restriction through here is coming, is we get a little bit of movement and then it just doesn't want to move anymore. And so those are things that I'm feeling for, of where those restrictions are, and then work on releasing that. Sometimes with the fascia we do some really deep work, like I might go here on her back and put my elbow into her back, and when I do that I don't just dig in and go as hard as I can, but I feel for where some of that tightness is and then dig into it and wait for it to release. And this helps to break things up. And it's a little bit of the more painful part of it, but this isn't the major part of the myofascial release. The most part of it is pretty gentle. So the fascia tends to respond to really light, long stretches. So that part that I was just doing helps to break some of those cross links up a little bit and some of the adhesions a little bit. But the real lengthening of it comes from just doing some simple stretches like this, of using the skin for a handhold, putting a little bit of pressure into it. And then the big key, and why a lot of people don't do myofascial release, is because it takes at least 2 minutes, possibly longer, to wait for that to release. And so it takes a little bit of time and patience to work with that. So as to demonstrate techniques, sometimes there's not much to see because they just put a little bit of pressure in and then sit here for a couple minutes. So there's not much to show there, but that's kind of the idea of what we're doing there. And then let's have you turn over the other way, Aubrey, and look at your neck. Let's go down this way.
I like don't know where to go.
And lay down, but with your head.
Oh.
So she has a little bit of stiffness in her neck, so we just wanted to look at that a little bit. And so,
there's a little bit of tension on that strap.
in addition to using the skin, we can use the bone. So in this case, I can use the head
Where
to be able to hold on to and move and find those spots that are restricted. And then a similar thing, it can look sometimes just like some typical range of motion exercise, but the main difference is I'm not pushing real hard into that restriction. I feel where the restriction is, just gently go into it, and then wait for it to release. So those are some of the main keys about myofascial release. Great treatment technique that helps with, because a lot of times it gets ignored in the medical system, even in physical therapy. So if you're having chronic pain problems, lots of different things, neck pain, back pain, fibromyalgia, TMJ, lots of things like that respond really well to myofascial release.